Medical experts report seeing more people with cardiac problems across this area.
News Channel 6's Renata Dubose gives us a look at the health issue and the possible cause.
Gold Cross ambulances, just like this one, have been hitting the streets of the CSRA each and every day to help people. But in the past year, they have seen more calls for a very important issue.
We have looked at the numbers and noticed that from last year this time, we were up 600 more chest pain calls.
Michael Myers tells News Channel 6 they believe people not following up with their doctors during the pandemic may be the cause of the increase.
COVID did a lot to scare people. A lot of things were done differently. People were doing telemedicine and still doing telemedicine. And now we are seeing, I believe, the results of those things happening.
Other local hospitals report seeing an increase in cardiac cases too. A spokesperson from Augusta University reports seeing a high number of new referrals to see new patients in the cardiology clinic. And nearby at University Hospital, a cardiologist reports they have definitely seen more chest pain calls, but it hasn't equated to more actual cardiac disease. He says he believes that stress, COVID, and general anxiety is causing a lot of people to experience chest pain. Across the country, some cardiologists saw the increase during the height of the pandemic, stress and simply neglecting cardiac tests.
We went back and looked at our number of stress tests that we had performed in May, June, and July of 2019 and compared it to May, June, and July of 2020. And what we found was there was about a 45% reduction in the number of people who were ordering or getting stress tests.
The Gold Cross also reports seeing a huge rise in overdoses and psychiatric calls. Renata Dubose, WJBF News Channel 6.